Hi there, and welcome to Aging Well in Virginia. I'm Jane Foy, and our guest today on Aging Well in Virginia is Dr. Jonathan Evans, who is a geriatrician. He has studied at the Mayo Clinic and been in Charlottesville for 20 years. He's also the medical director of Monroe Health and Rehabilitation here in Charlottesville. Jonathan, thanks for being with us.
Oh, thank you for having me, and thank you for giving me this opportunity to connect with people all across our Commonwealth.
Jonathan, you are a geriatrician, and what I'd like to know is what's the difference between a geriatrician and a gerontologist?
Sure, and I actually happen to be both. A geriatrician is usually a physician, but it's a clinician who cares for older adults and who has gotten some additional training along the way in order to help them understand better the unique aspects of older adults as it applies to healthcare. A gerontologist is somebody who studies aging, and aging can certainly apply to the human body, but there's lots of aspects of aging that go beyond biology and physiology that have to do with sociology, psychology, anthropology, really even economics and the law, that really look at aging not just from the perspective of one person, but the environment, the culture, the economy, and you know, if you think about certain places in the country where the percentage of people living there is older compared to places that where the average age is younger, there are differences in those communities that are intentional in order to meet the needs of the people that live there. And so right now, the overall population of this country is getting older, and that has lots of implications for everybody, not just older adults. But and many of them are extremely positive. Okay, for example, can you imagine how awesome it would be if everybody got to spend time with their great grandparents and learn their family's history and learn about how things were in the past? Having more older adults means oftentimes having more volunteers to do all sorts of wonderful things for communities. Often it means having a source of childcare for working adults and so forth. So there's so many positive things about an older, a society that has more older people in it. Just as there are many positive things about a society that has more younger people in it, and often both.
And often both. Well, is there a point at which I leave my primary care physician to see a geriatrician, or does my primary care physician work in conjunction with you, and why would that be?
Yeah, that's a really important question. I often get asked, well, at what age should I go, see a geriatrician? And let me just say first that primary care is a really fundamental and essential part of healthcare delivery. Your primary care physician, or your primary care provider, hopefully, is somebody who has gotten to know you over time. You've invested a lot of time in that relationship, and what you really need in this country as far as healthcare is to have an advocate. It's not necessarily the case that your physician is going to meet all of your healthcare needs. They'll help coordinate your care, and they'll help other people know you better and so forth. And so the relationship is what really matters. And if people, if you have a good relationship with your primary care provider, I would suggest that you keep it. And people like me can help support that by providing additional information or consultation to your physician. As a practical matter, there are only about 50 geriatricians per year trained in this country. So it's inconceivable that we would ever have the workforce of geriatricians in the same way that we have a workforce of pediatricians to meet a huge chunk of the primary care needs of.
Even though every study that we see says that this is an aging population,
Yeah.
but we're not training medical students to deal with that aging population.
Well, that's largely true. I mean, the curriculum for medical students and residents includes some geriatric training, but it's pretty limited, and partly it's because again, there aren't very many geriatricians, and most physicians that I know will say, in other specialties, will say, oh, I love older adults. I don't discriminate against them. I treat them exactly the same way, including the exact dose of medicines and things like that. And that really, in essence, is the problem. This idea of one size fits all medicine, it doesn't really make a lot of sense from a biological or pharmacologic perspective. And, we don't all wear the same size clothing. It doesn't make sense that we because we come in different sizes, it doesn't make sense that we would prescribe the exact same dose of medicine to people irrespective of that. And, people who are smaller and people who are, or women more so than men, because on average, women weigh about 30% less than men, are more likely to experience adverse drug effects because, in effect, they're receiving a higher dose than men if they're all taking the same exact size pill.
So there should be some cognition that obviously an older adult, 65 plus, is going to be treated differently than a 3-year-old.
Oh, absolutely. In fact, when you look, I mean, in a variety of ways, as we think about how the body changes over time, and aging is a normal process. I just want to emphasize, aging is normal. It begins even before birth. It's happening in the womb, and it happens to everybody. It's just that in this country, like many other countries, we tend to think of aging in people as somehow bad at a certain point, at some arbitrary point of our own. Each one of us has our own idea about what old is, but we tend to think of old as bad. I wouldn't expect any physician in any specialty to think that they're doing something wrong when they're doing things exactly the way they were taught. Okay, but but the thing about the practice of medicine is we're always practicing, hoping to get better, and ideally we're making progress and doing things better as we learn more and do better.
Well, then that does bring us to, what do you think are the more common diseases, ailments, illnesses that present themselves to older people? And I'm using the term, why, I don't know, but 65. But
sure.
what happens to us at that time?
Sure, there's a lot to talk about there, and you mentioned 65. That's for more than a century. That's kind of the number that people often think of as being old, because in part that's been sort of a retirement age, or an age at which you might be eligible for at one time a pension, or at least Social Security or something like that. It's the age at which you're eligible for Medicare. And I'm not yet 65, and I don't want to wish my life away, but I can't wait until I'm 65, because Medicare is such an awesome insurance program that, I'll have a lot less to worry about in terms of other things. But having said that, and I want to make the distinction between aging and disease. Aging is not a disease, but in terms of what happens to our bodies over time, some of which is really related to, stuff that happens to us over our lifetime, various physical or emotional traumas, accidents and injuries, all those things, wear and tear, I guess you could say, those things are, accumulate over a lifetime. And so we tend to attribute them to aging, but it could have been something that happened when we were much younger. But the bottom line is that, again, as we live longer, we accumulate stuff. We accumulate wisdom, which is awesome, but we also tend to accumulate chronic conditions, okay, that fortunately don't kill us, but they stay with us, something like high blood pressure or diabetes. It used to be that those conditions, a century ago, would have been fatal at a young age, before insulin. Diabetes was a fatal disease. And it's not been that long since we've had really good treatments for high blood pressure and heart disease and stuff like that. So the upshot is these conditions that may be permanent but aren't fatal anymore are things that we carry with us. The other thing that's important to note is that while aging is not a disease, the body changes over time, throughout our lifetime, and the changes that occur say after 65, and again, it's a continuous process, but what happens as people get older is the organs, well, at a certain point in our life they grow, and at another point they get smaller. So what that really boils down to is, let's say somebody who's in their 80s, okay, is going to have less reserve capacity in their heart and in their lungs and in their kidneys and so forth. So if people get sick for any reason, they're more likely to kind of decompensate and have more problems, possibly end up in the hospital. So but again, lots of common conditions like high blood pressure and diabetes are more common as people get older. And historically, things like cancer tended to be more common as people got older as well. That's unfortunately changing. There's an increase in colon cancer among younger adults, probably for environmental reasons that aren't entirely clear. But a lot of the things that we attribute to aging aren't really age related. They're related to maybe people becoming less active or more sedentary and things like that. I should point out that the population of people age 65 and older actually exercises more than any other age group. And if you go to certain places like Hilton Head, for example, you'll see armies of healthy older adults who are out, marching in the sun and doing all sorts of things.
Well, we know we always hear diet and exercise, and exercise. Tell me about attitude.
Generally speaking, people fear aging, and at a certain age, in middle age, let's say, people start testing themselves. Okay, and so, for example, if somebody were to walk into a room and forget what they went in there for, they might worry that they're losing their marbles or that they're going downhill. Or if you went to the car after shopping and couldn't remember where you parked, those sort of things, they're totally normal, and they're really due to people having busy minds and being distracted. But we tend to think of those as senior moments. We assume that, bad things are going to happen down the road. I mean, what's the point of living a long time if there's no reason, no purpose for getting up in the morning, And so, but people who have a reason to live can endure all sorts of things, even, so-called terminal illnesses, while they're hanging on to, for some important life event and so forth. And similarly, when we talk about living, it's not just that we are alive, it's about the quality of life, which most older adults are particularly concerned about, which is living well.
It is the living well part. Yeah. And the one thing we hear a lot about these days is how bad it is, negative it is for older adults to be isolated. Absolutely. But what do you do for somebody to get them out of their own isolation?
Well, in this community, like a lot of communities, there are lots of opportunities. Not everybody knows about them, but
if you have a loved one who, for instance, is closing in on themselves or isolating themselves, and you're a relative, a son or a daughter or whatever, very often, for instance, if I say to you, you're spending too much time on your own, you need to get out more, that will go, because I'm not the professional. So is that when when the primary care physician says, we're going to talk to a doctor who deals with aging? Sure.
Well, that's something that I and my colleagues would be happy to talk to anybody about anytime. But let me, since we're talking about a particular situation, let's explore that a little bit more. The first thing is, what's limiting somebody? Okay, is it this really gets to the crux of kind of our kind of negative attitudes about aging, and even the negative attitudes we have about ourselves, which I mentioned too. I did a study 20 years ago where we surveyed older adults essentially waiting to see their physician, okay, and we gave them a list of all sorts of symptoms, some of which were classics, warning signs of cancer and other stuff. And we asked them, is that disease, do you think, or is that normal aging? And without exception almost, people assumed that if something bad was going on, it was because of aging. Okay. And so there's a lot of times it has to do with what people's expectations are. Somebody who's limiting their interaction with others, maybe they have a hearing issue, they're worried about their bowels or bladder, maybe they have arthritis and they feel like it hurts to move and so forth. So we want to get at kind of what the root causes of that. But first and foremost, I just want to emphasize that's not what you just described. That's not normal aging. Okay. And so that is a sign. Those are signs of possibly medical issues or people being depressed and stuff like that. And it's sort of like with driving, for example. People, healthy older adults who don't have cognitive impairment, for example, if they will adjust to things in order to they'll adjust their driving habits in order to make themselves more comfortable. So, for example, if people have difficulty seeing at night, which could be simply a matter of the headlights, the casing getting dimmer or fogged over time, they are more inclined to say, well, I won't drive at night. Or if they're concerned about traffic, they'll say, well, I won't drive on the interstate, or I won't drive without a co-pilot. But they keep driving. They may modify it in some way. Until people reach a point where they're no longer comfortable, and then they really limit their driving or stop. Parenthetically, all of this talk about self-driving vehicles, that's industry understanding that the population, their customers are aging, and that their needs for transportation are different than they were when they were 20 or 30. But there's been some interesting studies about this phenomenon that you described. One of which was done at the University of Alabama a couple of decades ago. And what they found is they sort of measured, if you will, how far people ventured from their homes on a daily basis and they talked about the sort of radius of activity, if you will. So how big your world is, so to speak. And what they found is as people's world got smaller, their life expectancy shortened. Okay. And I remember talking with the department chair about this. It was really exciting work, and we had lunch together and we were discussing it. And the obvious assumption was, well, as people have health problems, they become disabled and they do less, and this is simply an indicator of poor, declining health and disability. But the thing that fascinated me then, and has been borne out ever since then, is that, well, what if you increase social interaction? What if you had an intervention where you got people out and you expanded their world? And in the last, quarter century, it's been shown that actually, yeah, that really does improve people's health and well-being, and actually increases their lifespan. So it's like you said, it's really about being alive and living and focusing on the quality of life and interacting with other people. Human beings, for the most part, were never made to be hermits and living in isolation. We're social beings, and we thrive, generally speaking, with the interaction of other human beings. Some people require less of that than others, but this idea of being alone is often equated with loneliness. You can be lonely and not be alone, but loneliness is also an epidemic that really negatively impacts the quality of life for people and health, and also disproportionately affects older adults.
All right. Finally, I want to ask you, what would you describe as what makes an age-friendly community?
Sure. Well, that's actually easy, because what makes an age-friendly community makes a friendly community, and what makes a hospital or a shopping center more friendly to older adults is really good for everybody. So that means, for example, if you were talking about designing a home, you would make it so that, and again, this benefits children and adults of all ages, you'd make it so that you didn't have a barrier from one room to the next, or like a threshold. Lots of older homes have maybe a wooden or metal strip, at a doorway, and that's a tripping hazard for people. Just as an example, you would, ideally make it so that there are a few barriers, fewer barriers like steps getting in and out of a building. Parking, if you're talking about people driving, is a big issue. Public transportation is hugely beneficial to people of all ages, and again, disproportionately older adults. And speaking of parking, there have been a bunch of studies repeated over many years that have shown the surveys of patients or potential patients to various hospitals and so forth. And it was shown that the number one factor that people consider when choosing this hospital or that hospital is parking. Okay. It always elicits the same reaction because it seems so absurd.
One would think it would be the physicians or
You
the
would think
medical staff
so.
in general.
Right. And the thing about it is that physicians think that people should crawl over burning coals and hot glass to get to them because they're so good. Okay. But but this is a fundamental issue, which is really, can you get there? Okay. And and if you can't get in the building, you can't get care. And so how you would make that friendlier for people is having valet parking, for example, or having a home visit program, or providing shuttle service, or things like that. Part of the reason that I've always made home visits, house calls, and gone to places like nursing homes instead of having everybody come to me is, for one thing, I've always had reliable transportation. It's easier for me to get there than it is for people to come to me. And in addition to that, it helps me see how people are functioning in their environment.
Your dedication to your patients is widely recognized. We are out of time. We would like to talk to you again.
Wonderful.
On the whole state of aging in Virginia. But thank you so much for your time.
Well, thank you. It's an incredible privilege and a great pleasure to spend time with you, and for all of you that are watching and listening. I can't thank you enough.
And thank you for tuning into Aging Well in Virginia. Thanks to our director, Dave Hersman, and thanks to INL Event Production for camera and sound. And we'll see you the next time on Aging Well in Virginia.